Welcome everyone. My name is Nina Foley. I'm a social worker at the Adelphi Breast Cancer Program, and I want to thank everyone for being here this afternoon for the Caregiver Forum and taking the time out of your day to come. I want to remind you that we are filming this or recording this on Zoom, as you can see behind us. And I know we left a message yesterday for people that our restrooms would not be working, but we were informed that they are working. So if you need to use the restroom, it is out the door towards the left-hand side. Okay, so I want to thank you, as I said, for being here. You're going to find in front of you some index cards, and that is for anyone who wants to share their contact information anonymously, just to get more additional services. Please fill out your name, your phone number, your email, whatever you want to share with us, and you can put it into the box which is in the back corner with other resources that we have for you that are from our program and from other programs related to caregiving. I want to mention, just in the interest of time, there will be no Q&A after this discussion. However, if you need any additional support, we will have staff social workers as well as Gerry, who I will introduce in a second, to stick around after the forum to talk to you. I wanted to give a brief overview of the Adelphi Breast Cancer Support Program and the support and the services that we do provide. First and foremost, we have our hotline, which offers the opportunity for callers to talk to a breast cancer survivor who can provide both peer-to-peer support, locate resources for the caller, and connect him or her to a social worker for individual counseling services for the survivor themselves and for family members. We have support groups that are in both English and Spanish. And we also allow, the hotline allows people the assistance to obtaining financial assistance if they need it. Our program also provides educational forums like this one and outreach events to raise awareness of the importance of health screening. The goal of the Adelphi Breast Cancer Program is to provide support to everyone that's impacted by breast cancer and to let them know that they are not alone and that we are here for them. While Merriam-Webster defines a caregiver as a person who provides direct care, as for children, elderly people, or the chronically ill, we all know that the role of a caregiver involves so much more. Caregivers change their daily routines, their daily focus, and often need to put someone else's needs before their own. Caregivers are loved ones, family, or friends with full lives who step up to the plate to help others in their time of need. They're just like you and me. Being a caregiver is meaningful but stressful. It affects people both physically and emotionally. The isolating role of being a caregiver can lead towards internalizing stress. It is important to get support. One way you can take care of yourself while being a caregiver is by joining a support group or participating in a circle with other caregivers. Support groups provide respite. They allow you to know that you are not alone, provide resources, allow you not to feel guilty for taking time for yourself. This forum will be a discussion about the challenges as well as some helpful suggestions to taking care of yourself while taking care of someone else. I will now give a brief introduction of the two knowledgeable and amazing presenters who are sitting next to me. First, I'm going to introduce Gerry Lennon, who began his life as an immigrant from Ireland. He was the first to become a US citizen in his family at age 18. He became a member of the NYPD at age 20. He stated that he wouldn't have been able to join without being a citizen. Gerry was a police officer for 25 years, which he calls the greatest show on earth, and describes the experience as never having 2 days the same. This helped him to deal with the needs to be versatile as a caregiver, and he will share more about that when he talks later. Gerry learned how to disassociate himself from the stress of the job, which was also helpful with his caregiver role. Gerry is a 9/11 survivor and was there when the buildings came down. Currently, he has been helping his NYPD coworkers who have been diagnosed due to exposure at 9/11. Gerry retired from the NYPD after 24 years and has been a sergeant in crime prevention of Adelphi's campus security for the last 14 years. He has been volunteering and supporting the Adelphi Breast Cancer Support Program for many years and started a Pink Patch program to bring attention to our program as well as providing fundraising. Gerry officially became a volunteer last year, but he's always been a member of our family because he always goes above and beyond in helping our program and in helping everyone else. He has extensive personal experience as a caregiver, beginning when his mother was first diagnosed with breast cancer in 1993. He then cared for his father during his pancreatic cancer diagnosis. He supported his sister during her breast cancer and during her last days, and is currently both his mother and aunt's caregiver. I also want to introduce Adriana Valencia, who's on my left, and she is a New York State licensed social worker. She is currently part of the Adelphi Breast Cancer Program, where she works as a bilingual social worker, serving individuals and families impacted by breast cancer. She received her BA in sociology from SUNY Plattsburgh and her master's degree in social work with a concentration in gerontology from the Silverman School of Social Work at Hunter College. Adriana has extensive social work experience working with individuals living with chronic health conditions and their loved ones. Prior to Adelphi, Adriana helped oversee the geriatric care management program at Lenox Hill Neighborhood House in Manhattan, as well as launch and run the house's caregiver program. Personally, she was integral in her mother's caregiving journey, as her mother became the primary caregiver to Adriana's 95-year-old grandmother, Alicia. Adriana enjoys spending her downtime outdoors with her husband, Juan, and their two children, Brandon and Sophia, and their English bulldog, Louie. So at this point, we're going to start our discussion. I'm going to ask Gerry a few questions about his experience as far as being a caregiver. First, I want to just discuss with Gerry, he's had many roles as a caregiver for many different people in his family. And I want to start with your mother when you initially became a caregiver. I know that you've discussed a little bit of feeling like you've always been a caregiver, but was there a time in your life when your mom was first diagnosed that you felt like you took on the caregiving role in a different way than you had in the past, where it became your identity more?
Absolutely. My mom was the first person in my family who had gotten sick. And due to the family dynamics at the time, I became the caregiver. I was the one who took my mom for her doctor appointments, for her surgery, for her recovery. You know, everything kind of worked out, and it was over maybe a 6-week period at first. So I was kind of, the recovery from the surgery was fairly quick, and maybe within 6 weeks she was back to work. So I really didn't consider myself a caregiver. It's what I was doing. I really didn't realize it at the time, and you know, that's how I was introduced to it.
Was there a time in your life when you did realize that you were a caregiver?
I'd say more so with my dad. He went into for some minor surgery, and it turned out he was in stage 4 pancreatic cancer at the time. They gave him roughly 6 weeks, and for 5 of the 6 weeks he was pretty good. And then the last week he kind of deteriorated really quick. Hospice was there, but my dad was a little hostile to hospice because he didn't think he needed them. He didn't want them in the house. He felt there was really nothing wrong, and that the doctors had to be wrong because he felt good. But when he took his turn for the worse, it was quick. Actually, right up to a couple of days before he passed, he was still up and walking. He was still eating. And then he kind of went and laid down on a Saturday morning, and he didn't wake up after that.
What
So
was different for you with your father than your mother that made you feel more like a caregiver, do you think?
I was there for pretty much everything with my dad. He really didn't need a lot of physical help until the very end. So it was kind of, it was really kind of surreal because if you look back, 5 or 6 weeks ago, he was fine. And he was just going into, just for a minor routine surgery. And the next thing you know, it's end of life for him. And it was to get to the point where I could believe it. And even the family was in disbelief just because it was so quick.
Yeah, and that sounds like it was a very difficult, quick transition.
It was.
Yeah. And then with your sister, it was also a difficult experience because she was diagnosed late with breast cancer. You want to just talk a little bit about how you dealt as a caregiver for her and how it was, how it was different from your dealing with your mother, helping your mother practically, and dealing with your father as well.
Each time I was a caregiver, it was a totally different experience. It was just ever changing. And my sister, she was diagnosed in December of 14, and she passed in October of 15. But she basically was sent home. They told her there was nothing they could do. Her husband was her main caregiver, but I would go up quite often and just to give him a break, let him go for a cup of coffee or tell him to go shopping or whatever had to be done.
And you were good at recognizing that he needed time by himself and you were there to help him.
He did need it because he was losing the person he loved. He was doing everything for her. He was out of work at the time. He took a break from work. And, it can get very overwhelming if you're constantly doing it. And, if I could come in and give him a bit of a break, my mom at the time also, she would come up and give him a break and, as best we could.
And I just want to interrupt a second and talk about how important it is to have a support system, right? And that must have really helped her husband as well as everyone in the family.
A lot of things happen that you don't realize that could happen, whether it's maybe not an argument, or maybe something's not going quite right with medications and you're having trouble with a pharmacy, or a drug company is not approving a certain medication that the doctor's insisting that you have. So sometimes you have to talk between the doctor and the drug company and come to some kind of an agreement, or maybe one will see the light, and usually eventually it kind of works out, but it takes a lot of work and it takes a lot of time, and it can be very, very frustrating. And for one person who's going through something so major, they're not going to have the time to or the ability to do that, and they're going to need help.
And what about for the people who don't have help? What suggestions do you have? Because you're in that situation right now, for instance, with your mom and your aunt, you're not getting a lot of support because no one else is around to provide it, right?
Basically, my sister passed, my dad passed, my aunt has Alzheimer's, my mom has Alzheimer's dementia. It's going pretty quick with the dementia. And I'm basically the last person left. And so everything is on me.
Right?
Yeah, so right now, presently today, my mom's in rehab. She's supposed to come home tomorrow. She fell in June. One of her 6 falls into this 2 years. And I'm trying to get them to extend another week just to get her legs a little stronger. So I'm getting cooperation from the rehab. I'm not getting so much cooperation from the insurance company. So I kind of have to run in between the two and make my case for both. I'm just waiting on a phone call today, as a matter of fact, to hopefully she's extended another week.
And, I know your training as a police officer, your successes in life help you a lot, just naturally, to be a leader, be in control, be able to navigate all of the practical elements of taking care of someone, whether dealing with insurance and getting the medications. But what advice would you give to someone who is either new in this role or overwhelmed by the role that would help them?
It can it very easily become overwhelming. There's a lot of work that you don't realize what you have to do or what has to be done. It's not a role that you can really train for. It's just suddenly you're there, and you have to adjust to it. I find I break things down and I take care of one thing at a time, and then I move on to the next one. I don't try to do 2 or 3 things at the same time, because at the end of the day, you'll get it all the time. And you will feel a little sense of accomplishment at the end of the day if 2 or 3 things go your way. Maybe you have to put something off till tomorrow. You know, my mom takes 11 medications. So at first that was so overwhelming for me. How am I going to figure out how to give 11 pills this one has to be given at 9 a.m. This one has to be given at 12. But I worked it out. I worked it out between the doctor and myself. We had a long sit down and talk, and we figured out when to give the meds. But there's things even with the medications that you have to think about. You know, all the meds, they come now 90-day supplies, and you can't wait till you're down to 5 pills in the cup to reorder. You have to, you know, now there's automatic, but some of them don't do it.
I know you talked a little bit about being overwhelmed originally when you had to deal with the medication and how it became a learning process, sort of like starting a new job and learning all the different nuances and requirements for the job. A caregiver role is similar in the sense you have to learn how to help someone else, both practically, emotionally. And you sound like you're really good at asking for help. You know, you mentioned that you talk to the doctor to help you to figure out what is needed. And I think that's really good advice as well, to know what your limits are and know when you need to reach out, right?
I did have to become the advocate between the insurance companies, the doctors, physical therapy, because, you know, at this point, my mom and my aunt, neither one can do it anymore. And if no one speaks up for them, you know, no one's going to bat for them. So I have to do it. And, you know, at the end of the day, sometimes I do good, sometimes I don't get what I want. But, you know, usually you come to a middle ground where January 1st is a date I don't like anymore. And the reason for that is my mom's drug plans. For whatever reason, January 1st is when the new drug plans come in, but the last 2 years in a row, both of her drug plans were discontinued, and we had to go into a new drug plan on January 1st. So I had to reorder all 11 medications on January 1st. And then the drug company tells me, well, we don't cover this drug and we don't cover this drug. If you want this drug, it's going to be $680. So now I have to go back to the doctor. I have to pull the doctor and I have to get an adjustment. Can she take a 40 milligram instead of a 50 milligram? Because the insurance company will cover a 40 and not a 50. And it's things like that. And they eat your day up. And at the same time, you're taking care of the person and maybe their personal needs or showers or making sure they get their food. And sometimes the day can get away from you. And then you have to hope there's cooperation from the person also.
And I was going to mention that because both your aunt and your mother are suffering from Alzheimer's and dementia. And with that comes some personality issues and some mood issues. And that can be really difficult to deal with as a caregiver. What do you do when things are really frustrating for you?
Well, at times, there was a great personality change in both ladies. My aunt became very pleasant and quiet, and my mother became very aggressive and angry. She knew something was wrong. She wasn't sure. She knew she should be able to figure out what was wrong, but she just couldn't. And she would lash out at me because I was the one that was there. And I knew I couldn't take it personal. I knew it wasn't her anymore that was being angry. But you know, when it gets overwhelming, and it can get overwhelming, I'd like to go for a walk. I'd take a walk for a half hour. I'd come back in, and the earlier incident, whatever did happen, was forgotten, like it never happened. And, you know, the last thing in the world I'm gonna do is argue with her or either one of them, because it's forgotten in 5 minutes on their side. It really is. And all it's doing is getting my blood pressure up, and I'm starting to feel frustrated. And then I'm saying, like, why am I doing this? This is really above me. What can I do? And, you know, both of these ladies are very, very strong little ladies. And, you know, my mom's attitude is nobody comes in my house to help me. So as far as.
That's a lot of pressure on you.
Yeah. As far as an aide coming in or someone coming into the house, it's not happening with my mom. My aunt, I went through 6 aides in a 2-year period because everything went well for the first week or two, and after that it fell apart. And, you know, it's.
And I have to give you a lot of credit for knowing your limits and knowing when you are at your end and you need to walk away and take a break. And I think however that works for caregivers, if it's taking a break, if it's talking to a friend, that it's so important to be able to recognize that you need that for yourself and not to feel guilty. That, you know, sometimes we hear that caregivers feel guilty taking time for themselves because they're so enmeshed in the role of being a caregiver, but you need to recognize, it's important to recognize your own needs as well as the caregivers. I wanted to also ask you, you know, you mentioned at one point about setting caregiver goals. Can you talk a little bit more about that and what works for you?
My main goal every day right now with my mom especially is to get her to bed in the evening in the same condition maybe that she woke up in. My mom's very stubborn. She's very not very good on her legs. She's tends to fall. She hides her walker. She hides her cane. She doesn't want people to see that she uses a walker because she doesn't want them to talk about her, the neighbors or anything like that. So I'm all day long, I'm taking the walker, I'm putting it back at her side. And, you know, 2 hours later, I'll find the walker's hidden again. But I go through the whole day like that. And, you know, it's a good day when she can go to bed and she's not hurt, not injured. She didn't fall. And, you know, my goal right now, it's day to day. It's like she's not the same person she was 2 years ago. There's a huge change. But in the end, I have to be there for her. I have to be. That's it, you know.
And it's really impressive, like how strong, how determined you are, but that you also recognize what the challenges are as well. And I think it's really important to set goals, you know, and to just like you talked about breaking things down into easier accomplishments. If you look at your goals as a caregiver, that way you can see the achievements. Finally, I wanted to ask you, how do you recognize that you need to take a break or you need to nourish yourself, that you're, you know, that you're struggling?
It's like you're on a, like you're always on heightened awareness. I feel like I really don't have time when she's awake during the day. I feel like I can't sit down and relax. I have to either keep an eye on her. I have to either make sure her needs are met, her food or her washing up or whatever has to be done. And it's like a constant, like I'm constantly watching, constantly listening. At night, I just give an example. When I sleep at night, I sleep with the door open. I do have a CPAP machine, which I can't use now because I have to listen to see if she's trying to get up out of bed during the night, which happens. She doesn't sleep a lot. She does like to go to bed early, but she wakes up 3 in the morning, 4 in the morning. And, you know, I have to listen to, do I hear her out in the hallway?
And you're telling me the opposite. So what do you do when, you know, when you're awake during the day and it's just overwhelming? You talked a little bit about taking a walk.
I will take a walk.
But how do you know that you need it? What helps you? Just so you can help other people as well to recognize when they need to do something for themselves, because that can be one of the hardest things for a caregiver.
Sometimes I'll feel a feeling of frustration. And I'll just know I just need to take a break. I need to go have a cup of coffee I need to sit down quietly in a chair in a corner, or I'll get in my car and I'll go for a drive. I don't care about traffic. I'll sit in traffic all night. It doesn't bother me anymore. I can sit in the traffic. I don't even turn the radio on in my car. I can just sit there and, you know, it's a break for me. That's, you know, just little things that,
Right.
you know, they add up.
That was, well, yeah, and it sounds like you really need to isolate yourself, to be alone, to unwind when you're going through a particularly difficult time. And that's what works for you.
I like to get her to bed at like 8:30 at night. That's her time. And then 8:30 to 10:30, I might have a couple hours where I can sit down, and I know she's gonna be asleep, but every once in a while, about 9:15, you'll hear her trying to climb out of the bed. So I have a hospital bed for her now. And it's just,
It's a never ending goal.
it doesn't end.
Yeah, and you talked a lot about how much it changes, you know, it's very unpredictable.
It does change. A lot of things change. It's the things you might be doing in the beginning aren't the same that you're doing now. Maybe in a month from now, I'll be doing something totally different. You know, the Alzheimer's and dementia is a disease that advances. She will be able to do less and less for herself. And at some point, I'm going to have to decide, is she going to go into a home? And that's the one thing I've always tried to avoid. I find myself pushing the goals a little further. I mean, I've already passed the point where I thought for years, if it ever gets to that point, I'll have to put her in a home. And I've already passed that, and I keep changing the goal line. But I know
You're
eventually,
changing that way as well. You're
Yeah.
changing as well as the needs are changing.
you know,
Right?
there were things I swore I could never do to my mom, and I do them. And
What would you say to someone else who is struggling, for instance, with all the changes that they have to deal with day in and day out? You know, they feel like maybe they've accomplished and they've gotten a routine down, and then the rug is pulled out from under them because the requirements are different. How do you transition that way?
it's one step at a time. It's you have to, as it comes, you have to handle it as it comes. And like just an example, my mom, she fell in March, she broke her hip, she was in rehab. She came out of rehab, and while she was in rehab, the doctors changed all 11 pills that she took. Every single one went to a different strength. So I had to reorder 11 different pills, and trying to explain that to a pharmacy company that I need a 90-day supply of 11 different pills. Some of them were very, very expensive, but it got done. It was done.
And you're so, you know, you're such a good role model, and I'm so grateful that you shared your personal story, because you show how, even though it's not easy and things change, that you're able to successfully do this. And you recognize that you need to be there and that you can take time for yourself when you need to. And I really thank you for being here and sharing with everyone. I'm going to transition now and have Adriana talk a little bit about her experience with caregivers. If you remember from the introduction, she's a social worker who's worked with caregivers, and she also has some personal experience as far as being a caregiver. So thank you, Adriana.
Thanks, Nina. Thanks, everyone. I really want to say thank you so much, Gerry, for sharing your story and your experience as a caregiver. There are so many in this room and across Zoom that can hear themselves in your words. As you mentioned, caregiving is such a unique journey, and one that at times can feel incredibly lonely. But the truth is that Gerry is not alone.
It's very true, Adriana. Studies show that numbers of caregivers is growing.
That's right. The organization AARP reports that more than 1 in 5 Americans define themselves as caregivers last year alone. This totals an estimated 53 million adults in the US, an increase from 2015. Caregivers can be found across all generations, races and ethnicities, and gender identities.
We heard Gerry speak about how he became a caregiver. Essentially, he was called upon to become a caregiver with little or no warning or prep. What would you say? Would you say this is true for most caregivers or many caregivers?
I would say yes. I think in speaking with caregivers, you will find that many of them, like Gerry, the role of caregiver creeped up on them. What was once a monthly check-in with mom and dad has now become a weekly one, or a loved one is diagnosed with cancer and you find yourself helping coordinate care and transportation. For many, becoming a caregiver is simply not a choice, but a necessity. Oftentimes, there's a medical emergency or a decline in health that occurs that impairs the care receiver's ability to coordinate their own care or affects their ability to manage their day-to-day.
Very true. And what are some of the challenges caregivers have shared with you?
Yeah, as we heard Gerry mention, from his experience, no 2 days look alike. From helping loved ones in their day-to-day activities like getting dressed, to bathing and feeding, to helping with transportation, grocery shopping, housework, and managing finances. Looking back at my own experience as a social worker, a lot of the challenges caregivers faced were around what we heard Gerry explain: coordinating care, getting doctors on the phone, securing physical therapy and OT, working with insurance companies to figure out what is covered and what isn't, learning the in and outs of home care, how to secure it and manage it, especially right when you have a loved one who's gone through 3 home care workers in the last month. Figuring out medication and medical care, ensuring your loved one is taking medication on a schedule, learning how to change dressings when the nurse isn't able to come in.
You have many different hats to wear as a caregiver, and you have to learn how to become different professionals, basically.
Absolutely, with little to no preparation. I would also add that some of the difficulties that exist around role reversal. As an adult child providing care to an elderly parent or a loved one, the power dynamic changes, and that can be difficult to adjust to, not only for the caregiver, but the care receiver as well. And when we speak about providing care to those with Alzheimer's or dementia or chronic health conditions, like we heard Gerry mention, personalities sometimes can change, and our once soft-spoken brother or witty spouse is now difficult or aggressive. It's another added layer to an already difficult task at hand. And the truth is that when we take on the role of caregiver, life doesn't stop. You are often asked to provide care while you're working full-time, managing a home and a career. I can recall my own personal story, watching my mom become a caregiver to our grandmother, and she would wake up at 6 in the morning to get ready to work at her factory job, ensure that my grandmother's medication was set at the table, that her home care worker had come home. She would work 8 hours, manage as a machine operator, and come home and check in on us, make sure that food was ready, that my grandmother was bathed. It was a nonstop job. And like my mom, so many others find themselves trying to balance their own needs, but the needs of their loved ones as well.
Would you say that balance is important?
Yeah, absolutely. Striking a balance is key. The question becomes, how do I ensure that I'm taking care of myself so I can be the best version of me to my loved one, but also to myself? And this is so incredibly important, as we know that caregiving can have an impact on both the physical and the emotional well-being of caregivers.
Could you share a little bit more on the impact? I'm just thinking about what you said as far as role reversal, for instance, and the emotional impact that has.
Yeah, I think, a lot of times we focus on the negative. There are positives to caregiving. Studies have shown there are many benefits from being a caregiver, and they can include a sense of fulfillment and a deeper connection between the caregiver and the care receiver. Yeah, I would say in my experience as a social worker and personally, it supports what the data shows, that though the benefits of caregiving are plenty and very real, caregiving can negatively affect one's mental and physical health. As individuals, I think we can all agree in this room that at one point or another, we've experienced stress. And the truth is that short-lived stress is actually not a bad thing. It can help motivate us and serve as a catalyst for change. However, as humans, we aren't meant to experience stress and elevated periods of stress for extended periods of time. And if we look at a caregiver's journey, the average duration of a caregiver's role is about 4 years. And many, as in Gerry's journey, some are called upon to be a caregiver for multiple loved ones in various points in their lives. For many caregivers, they find themselves experiencing stress for extended periods of time. Physically, when we talk about the impact, we know that long-term stress can affect a caregiver's nutrition, the quality of their sleep, their immune system, as well as lead to GI issues, cardiovascular issues, and chronic pain. As I look at my time working with caregivers, so many of them place their own health needs on pause. Many miss their own important doctor's appointments and screenings and couldn't remember when their last annual checkup had occurred. What can we say about the emotional impact? Well, studies demonstrate that caregivers have an elevated risk for developing depression and anxiety. Now, this is not to say that all caregivers will experience negative feelings or that caregiving itself will produce depression. However, in a role that demands so much physically and emotionally, caregivers often sacrifice their own needs, causing a great deal of emotional strain.
Adriana, in your experience, have you found that caregivers have a difficult time discussing some of the emotional strain that caregiving can bring on?
I have. I think we can also agree that expressing how we feel, whether you're a caregiver or not, isn't the easiest thing in the world to do. But in my experience, many caregivers feel uncomfortable sharing about the challenges they face and the feelings around those challenges. Why? Because being a caregiver is who they are. And when you're on call 24/7, there's no time to process feelings, or simply we find that no one asks. How many in our lives have we seen have taken on the role of caregiver, preparing meals and coordinating care, yet no one ever takes the time to ask, how are you managing today?
When you were able to get caregivers to open up, what were some of the feelings that they expressed?
Caregivers, with no doubt, are superheroes, absolutely. But often what we don't hear about is the anger, the resentment, the sadness, the isolation, the exhaustion, and the guilt, all which can place a heavy toll on one's overall well-being. The bottom line is that all these feelings are valid. It's okay to feel anger. It's okay to feel sad and experience resentment. We're human. It's how we process these feelings and are able to move forward that is key.
As a social worker, how have you been able to help caregivers who may have experienced some of these feelings and not talked about them?
As a social worker, one of the things that I hold most pride in is being able to hold space with someone and providing them the opportunity to share how they feel without judgment or expectation. It's one of the greatest gifts I feel that our occupation can provide. I remember one caregiver in particular, after months of working together, shared, I'm angry that I have to do it all, while my brothers are able to go to work and do it without a care in the world. She shared that she was angry that there were not enough hours in the day and that she had to leave her oldest daughter taking care of her 5-year-old as she ran to the hospital after dinner. She expressed pent-up feelings of loss, grieving the mom that she was losing, the career that she was unable to focus on, and the experiences she had to place on pause to be there for her mom. She shared how guilty she felt, often felt that she was not doing enough or being able to show up for everyone as she was expected to or wished she could. We sat there and I held her hand. It was the first time in a very long time that she could put a voice to all that she had been carrying as she cared for her mom with COPD.
That's so important that you shared that and that people know it's okay to have feelings and that they're entitled to and they're valid. Adriana, what would you, we often hear about caregiver burnout And what is it? What would you say are some of the red flags that folks should keep in mind?
Yeah, I think caregiver burnout is defined as a state of physical, emotional, and mental exhaustion. It may be accompanied by a change in attitude from positive and caring to negative and unconcerned. Some of the symptoms or red flags to look out for are very similar to the symptoms of stress and depression, and they can include watching yourself withdraw from friends and family and other loved ones, losing interest in activities you once enjoyed, changes in appetite, getting sick more often, and feelings of wanting to hurt yourself or the person for whom you're caring. It's important to practice self-awareness. And I think we heard a little bit about that from Gerry, right? Checking in with ourselves. So not only checking in with yourself, but reaching out to someone you trust. And it doesn't have to necessarily be a social worker. It could be someone that, a friend, a neighbor, someone you care about. And if you find yourself experiencing burnout, it's important again to reach out, but it's even more important to build a support system around you to help prevent it.
Well said. Thank you. Thanks, Adriana. How can social workers help caregivers?
That's a great question, Nina. Social workers can be such a great asset for caregivers and families. As social workers, we're able to assist with many of the practical ends of caregiving as well as the emotional piece as well. So for example, social workers can help access resources for you and your loved ones that you may have not known you were eligible for. So such as Medicaid or pooled income trust or government assistance programs. We can help you identify services that enhance your experience as a caregiver as well as your loved one, such as respite care, day programs, transportation, or Meals on Wheels. We can also help your family talk about difficult topics such as end of life and advanced care planning, and make recommendations on where to access information on advanced directives, wills, and power of attorney. Emotionally, we can help caregivers provide you with comfort and help you feel less alone. And through individual counseling, social workers can help identify and fortify existing coping skills. I think a lot of times we forget just how resilient and strong we can be. And if we just take a minute, right, to look back, we've all faced difficult situations, and it's important to be able to look back on those and identify what helped me pull through and being able to build up on those. We can also help you locate support groups. From my experience, support groups are a wonderful way for folks to connect with each other. Members often share how life-changing it can be to hear that they're not alone and they have a space to share resources and give back. But I have to be honest, caregivers can be tough. They have to be, especially when dealing with so much. As a social worker, when suggesting social work services, I've heard everything from I don't need a social worker to I don't like talking about my feelings, I don't have time, I've got this, I'll call you if I need you. And I respect that. If it's one thing that we learn in social work school, it's to meet the individual where they're at. And the truth is you have to, right, as a provider. But what I also know is that speaking with someone and others helps. And though you may feel as if no one understands or nothing will change, social workers at their best, as I mentioned, are here to be able to hold space with you. No judgment, no expectations. And that when you're wearing what feels like 1,000 hats can be a lifesaver.
Well said. Thanks so much, Adriana, for sharing the social work perspective. It was really helpful. And, you know, if there's one thing that people can take out of today's forum, it is, from my perspective, that you realize the importance of helping yourself and knowing how hard it can be to be a social worker, and that it's okay to spend a little attention on yourself and to acknowledge when you need help. We're going to transition at this point into a discussion about the reflecting about what it is to be a caregiver. I'm going to be asking both Gerry and Adriana some questions about their experiences. about how to support people who are new to the caregiver role, or someone who's really struggling with being a caregiver and needs help in replenishing their lives. One thing we didn't mention earlier, Gerry, is has there ever been a time in your life when you've reached out to someone else, you know, when you've gotten support from someone else?
That's how I became involved with the breast cancer hotline. I'm 100% Irish, which means I don't talk about my feelings. I don't tell anyone how I feel. I keep it inside, I bottle it up, and you know, that's the way I was, that's the way I am. My sister was diagnosed in December of 14, and she was stage 4 when she got diagnosed, and it's kind of like a slap in the face, like a wake-up call for me, because it was just like, when we found out she was sick, it was already terminal. So one day on campus, right after she was diagnosed, I accidentally took a stroll through lower social work and met Erin in the breast cancer in her office. And, you know, I started talking to Erin. I had never met her before. And within 5 minutes, I was in the office with the door closed, and, you know, I was pouring my heart out to her. It's nice to have someone who can listen to you and will listen to you, understand what you're going through. We had some long discussions. I was probably stopping in twice a week then as it was going on. But what really stood out with me is, you know, Erin explained to me, you know, there are going to be stages my sister goes through. And, you know, it's not all about me at the time. It was, you know, she was going through a lot too. There's a person there on the other side. You know, that's something I have to remember too. It's not like I'm just cleaning up for somebody or making someone a dinner. There's a loved one on the other side there. And, you know, at first my sister was in total disbelief.
Can you just talk briefly, because in case people don't know about the stages, what are you referring to?
The stages in the
Accepting?
I guess accepting that you're terminal, or that, you know, the inevitable, what's going to happen.
Mm-hmm.
Because the doctor walked right in and said, you know, basically to her, you know, you're so far advanced, we're just going to send you home and keep you comfortable. And that was it. That was basically what the doctor said to her. And, you know, at first she was disbelief. No way, it's not happening to me. This couldn't be. Then it was anger. She was angry. Why is God doing this to me? Why is this happening to me? What did I do to deserve this? Was a line I would hear. And then it was, she wanted to fight. She said, I feel good. I feel good. You know, I'm strong. I'll go to radiation. I'll do chemo. I'll do what I have to do. The doctor really didn't want to do chemo at first, and then he decided they would try it. And she went into a coma with the first chemo treatment for a week. And then basically she did wake up and she was sent home. And eventually it got to the point of acceptance. And once she accepted it, she was back to the way she was. She was, I won't say happy, but she was nice. She was pleasant. She was, you know, loving again. She made her peace. And eventually, you know, it was really something. I thought it was amazing that she could make her peace with that. And
that must have given you a lot of relief.
It did give me a lot of relief. My sister and I really didn't have the best of relationships. We did have a reconciliation maybe about a month or two before she was diagnosed. So, you know, I was very happy that we had. We had kind of buried the hatchet.
And I thank you, you know, for being so honest and sharing that. And I think it's really important because it just shows the other possibility for being a caregiver. Relationships are difficult, and a lot of times you're taking care of someone that you've had challenging past relationships with, and you are put into this role of having to be there for them. And there's going to be maybe resentment, there's going to be anger, and that's okay. It doesn't make you a bad person. It just makes it more, you know, it's important to be able to acknowledge it. you know, because things do get messy sometimes, and being able to acknowledge it, reach out, know there are people there for you who you can talk to is really important. So thanks for sharing that. I wanted to ask both of you, two positive or beneficial things you've gained from being a caregiver or working with caregivers. Do you want to start, Adriana?
Yeah, I think in working with caregivers, two positive things that I've seen folks gain is a sense of fulfillment, knowing that you were able to be there for your loved one and were able to give back. And it gives you, I think many have shared, a new perspective on life. It pushes to think about your own future and your wishes as you age or possibly face a medical emergency.
What about for you, Gerry?
So I felt it was very important to be there for the people who were there for me when, you know, whether they raised me or, you know, my sister when I was, you know, maybe in a fight when I was a little kid and she jumped in the middle of it and broke it up for me, or, you know, it's just, I just felt I had to be there for them, and, you know, I'm still there, and I will be until the time comes, the end, and it's just,
It fulfills your sense of duty and need to be there.
yeah, and it's, if I don't do it, who else is gonna do it for my family at this point now? It's, you know, I'm the one, it's me, so.
Thank you. What about, are there two things that you would have liked to know initially that you do know now about being a caregiver?
Don't get overwhelmed. Everything can be done at the end of the day, it's gonna get done. I'll tell you, when you sit down in the morning and think of everything you have to do during the day, it can get so overwhelming. And just to go at it piece by piece, break it down and one thing at a time, and do the best you can. There might be something that you might not be able to do. You might have to get someone to come in and help you. Maybe there's a really tough medication that has to be given and maybe you're not able to do it. And you can ask for help. And, you know, don't be afraid to ask.
And you don't feel like you knew that initially?
Initially, I always thought it would be always me, just me.
So you learned to ask for help when you needed it, which is a hard thing for a lot of people. So I'm glad you shared that. Was there anything else that you feel like you didn't know initially that you know now?
How to talk to the insurance companies and the pharmacies.
Oh, fun. Any words of wisdom?
Wow. Persistence. Sometimes there's buzzwords that they suddenly start listening to when you say something. Like if someone's in rehab and they want to let them out early or send them home, throw in the word danger. They could be a danger to themselves, or they're not quite ready. They're not there yet. It's dangerous. And when they hear the word dangerous, it kind of puts them on alert.
Good advice, really helpful. Thank you. What about for you, Adriana? Things that you didn't know, or people that you worked with didn't know initially?
Yeah, I think similar to what Gerry was saying, when you go into the role of caregiver as a newbie with little to no support, it's kind of like being a rookie quarterback. Right? You have to take time to study the needs and put an action plan into place. And I think you have to recognize what your strengths are and areas of improvement, and making sure that you reach out to others who may be a better fit, right, for some roles. I also feel that it's very easy to fall into a routine of the day to day, especially when running from an appointment to another, managing care. I think people would like to know the importance of making time to connect with their loved one, whether that's date night at home, right, watching a movie or a simple yet nourishing meal, reading a book together, or going over old photos. Like Gerry said, the care receivers, there's someone, with memories, with life to be lived, that wishes to be connected. It's just not a caregiver and a care receiver. It's a person.
Yeah, I'm going to take it to a different level when you said going out to dinner, because this is something we haven't really touched on in depth. As far as guilt, which is something that comes up a lot when people are a caregiver, it's very hard for them to find the time to do something for themselves. And if that means even going out to dinner with a friend and not being at home with the person they're taking care of, have you been in that situation, and have you had to support someone in that situation, as far as giving them permission to help, themselves to live their own lives.
Yeah, absolutely. And I think it's the way that you frame it, right? So many caregivers give themselves completely, right? 110%. And the way that I tend to frame it is, in order for you to continue providing the care that you wish to give, you need to take time to replenish yourself, right? You can't continue running on an empty tank. So, it might sound silly to go out for dinner, things like that. But when you take a step back, in order for you to show up and be the caregiver that you want to be, you have to be able to take time and take care of yourself.
Yeah, and I love the analogy of like when you're on an airplane and you always take the oxygen first before you can help the child. It's so important. You have to give to yourself before you can give to others. And I think sometimes when people are in the role of caregiver, it's hard for them to remember it because they're so stuck in that role and they cannot think of ways to help themselves, and they feel guilty perhaps that they should, they shouldn't be helping themselves. Has there been an experience that you could share when you've convinced someone of being able to give to themselves?
Yeah, I think the word like self-care has become like this big, everyone hears self-care, right? Do this and do that. But I really think it's about letting folks know that you can do something that you enjoy every day, whether that means turning on the radio and dancing to your favorite song, watching a favorite TV show, working in the garden, painting or reading, finding ways to relax. You can go on YouTube and do meditation, right, for 10 minutes, or, walking, going for a walk in nature. I always recommend doing something that you love to do as a kid, right, to find that joy. Or doing something that you always wanted to do, whether that's, baking something at home or learning how to knit. It's something that's yours.
Right. And I think it's really important what you said, doing something for yourself.
Yeah.
And intentionally doing it for yourself is really helpful. Thank you. What about a challenge that you've encountered? What would you think?
I've encountered a lot of challenges. There are things that I do now that I always thought I couldn't do. And when it becomes time that you have to do them, you just do them. And so, yeah, and at the time you're doing them, you don't think about it. I won't get into detail of what I'm doing, but it's one thing when you're, it's when I have 3 children also, and there were things that I did for my children. And I said, oh, I could never do that for my mother. And I'm doing it now for my mother. I spoke about that earlier, where I'm always changing the goal line. And, I'm finding out I can do more than I thought I could.
Which must be, a triumph in some ways, to feel that, even though you're put to a test and put into an uncomfortable situation that you never thought you'd be there, but that you're able to do it.
Sometimes I'm surprised I do it, but it's still, it has to be done, and I'm the one that's going to do it. So.
What about for you, challenges? Is there?
I think as a social worker, working with caregivers, navigating system is really hard. Rehabs and health insurances and not getting the answers that you're looking for, sitting across someone and having to tell them, I'm so sorry, they're looking to discharge, mom, or the insurance isn't covering your wife's medication. It's difficult. And though I always say, I wish I had a magic wand, but unfortunately I don't. But what I can provide is myself, right? To let our clients and our caregivers know that they're not alone in this journey. And though I may not have the answer, I'm not going to stop until I find something. So, but it's challenging. It's challenging when you're when you're working with a system.
Yeah. Well said. I agree. What about triumphs? Have there been triumphs for you?
Yeah.
Or have you seen triumphs in caregivers?
Yeah, I think when my mom finally, learned that she needed to take time, for herself. And so, and making it a priority. I saw the difference as her daughter, when, she decided to start selling Avon. And that was, it allowed her to get around and start meeting folks in the community. And she loved it. And it brought her back that sense of self.
Oh,
That was definitely a
said.
triumph.
Right. That's great. And finally, I'm going to wrap up today's discussion about replenishing, and that's something we want to end on as far as how do you replenish yourself? Because this is a very difficult role often. It's a time-consuming role. It's an overwhelming role for people. But within that, what helps to replenish yourself? And what would you say, Gerry?
I take my walks. I'll drive. I spend money on eBay. I do collect some things, and I like my quiet time.
And I love that you share that. And I think it's important to state that everyone is different. And what works for Gerry might not work for someone else, but it's important that you find that thing for yourself that's going to make you feel replenished, make you feel nourished, and that you're not feeling so isolated and single-minded in the role of a caregiver, which is really important. Anything that you can think of as far as replenishing? I know you stated about doing something for yourself.
I think like with self-care, replenishing, it could also become like one more task, and then you can feel guilty because you're not practicing self-care. So I think it's just really, practicing compassion towards yourself, right? And knowing that, you're doing the best that you can. I think that's
Really
so
good.
important.
So true. Yeah. So I want to thank everyone for coming today and participating. I want to remind you that we have index cards on the table. If you want any information from our program, please write your contact information, your name, and there's a box in the back that you can drop it in so it's anonymous. We have some resources in the back as well. And we will be sticking around afterwards if you want to talk to us or need to tell us anything. We're happy. And thank you so much. I hope this was helpful for everyone.